Hi everyone, I'm Sir Yulay, and for this slide sets, we will be discussing vaccines. Vaccines are materials that can artificially induce immunity to an infectious disease, usually following injection or in some cases, ingestion of the material. They have been treated to make them non-pathogenic. Vaccines are given to induce an immune response and subsequent immunity. As you can see in this throwback slide, vaccines confer artificial active immunity. Vaccines work by imitating an infection. Once vaccinated, the body is left with a supply of T lymphocytes and B lymphocytes that will remember how to fight that disease. However, it typically takes a few weeks for the body to produce T lymphocytes and B lymphocytes after vaccination. Sometimes, after getting a vaccine, the imitation infection can cause minor symptoms such as fever. Such minor symptoms are normal and should be expected as the body builds immunity. According to the National Immunization Program Manual of Operations, the two most important considerations in ensuring optimal result are timing and spacing. Multiple vaccines can be administered at the recommended schedule and time using different injection sites. Two or three inactivated injectable vaccines can be given in the same visit. For example, Penta and IPV can be given at the same immunization schedule at different injection sites. Simultaneous administration of two live vaccines can be given in same visit. Example, OPV and MMR. Longer interval between doses does not reduce the effectiveness of the vaccine. Therefore, it is not necessary to restart the series of any vaccine due to extended interval between doses. Example, when the child does not come back for the second dose of Penta at 10 weeks, but rather after the child is already 5 months, we can still continue with the second dose and advise parents to come after a month for the third dose. Vaccine doses should not be administered at less than the recommended minimum intervals or earlier than the indicated minimum age. In summary, longer interval between doses does not reduce the effectiveness, but shortening the interval is not recommended. In the Philippines, a child immunization record is provided. Included in this is the minimum age when a vaccine is recommended to be administered. Reasons for never administering a specific vaccine is termed as absolute contraindication, while reasons for delaying administering a specific vaccine are temporary contraindications. An infant or person who has a history of anaphylaxis or a severe hypersensitivity reaction during the previous immunization is an absolute contraindication to subsequent doses of a vaccine. A mother or parent is strongly objecting to immunization of a sick infant is a temporary contraindication. Just ask the mother to come back when the infant is well. You can also delay administering a specific vaccine if a child is suffering from some chronic conditions and is under medication. Consultation with the primary physician could result in postponed immunization until after the medication or treatment is completed. Vaccines could either be attenuated, inactivated, toxoid, subunit, conjugate, or mRNA. Attenuated vaccines contain a version of the living virus or bacteria that has been weakened so it does not cause serious disease in people with healthy immune system. Immunity is elicited by replication of the attenuated microorganism in the vaccinated person. The immune response to a live attenuated vaccine is identical to that induced by natural infection. Persons with most forms of altered immunocompetence should not receive live vaccines. However, exceptions exist. For instance, MMR and varicella are live vaccines that can be given to patients with HIV who have a CD4 cell count more than 200. Examples of live attenuated vaccines include TB's BCG, oral polio vaccine, measles, mumps, rubella, varicella, or their combinations MMR or MMRV. A very handy mnemonic that I use is Mobuhay ka. Mob as in MOB, M for MMRV or MMR, O for OPV, and B for BCG. Using the word mabuhay allows me to remember that these are live attenuated vaccines. Inactivated vaccines are made by inactivating or killing the germ during the process of making the vaccine. Inactivated vaccines induce cellular and humoral responses, while inactivated vaccines mainly induce a humoral response. As such, for the attenuated vaccine, they induce a strong, often lifetime immunity, but for inactivated vaccine, a weaker immune response is produced and booster shots are usually required. The disadvantage with attenuated vaccines is that they may revert to virulent form. Often, they are contraindicated in pregnancy and immunodeficiency. Inactivated vaccines are safer than live vaccines. Common examples of inactivated vaccine that you must remember include IPV or the inactivated polio vaccine, rabies, hepatitis A, pertussis, typhoid, and cholera. I actually have a memory aid or mnemonic in remembering the inactivated vaccines, but it is actually rather crazy. Sometimes, though, the ridiculousness of the mnemonic helps. So here it is: RIP or rest in peace, take care always. Crazy, right? RIP stands for rabies, IPV, and pertussis, and take care TC, typhoid, cholera, and always hepatitis A. The phrase rest in peace allows me to remember that these are killed or inactivated vaccines. Sometimes, instead of using the terms IPV or OPV to describe the polio vaccines, some examiners use the words Sabin or Sok, who developed the OPV and IPV respectively. So, how do we remember that the OPV vaccine is also known as the Sabin vaccine? Isolate the sound sabi in Sabin and just say sabibig. Sabin is given sabibig, that would be oral polio vaccine. A little disclaimer though, the developer of the OPV vaccine is pronounced as Sabin. The IPV developed by Salk is given subcutaneously or sub-Q. Toxoids are made from inactivated toxin. Examples include diphtheria and tetanus. Here is an easy way of remembering the two vaccines classified as toxoid. A subunit vaccine include only parts of the virus or bacteria or subunits instead of the entire germ. Example is the hepatitis B vaccine. This vaccine is composed of highly purified hepatitis B surface antigen or HBsAg adsorbed to an aluminum adjuvant. Probably you have seen in your textbooks vaccines abbreviated as DTaP, that is D, T, A, and P, or TDAP, that is T, D, A, and P. The AP in those abbreviations stands for a cellular pertussis. These vaccines are based on individual purified B pertussis components. These vaccines are similarly effective as whole cell vaccines but much likely less to cause adverse reaction. The whole cell pertussis vaccine found in DPT used here in the Philippines is actually an inactivated vaccine, but the acellular pertussis, abbreviated as AP, is a subunit vaccine. Much like the subunit vaccine, conjugate vaccines use only portions of the pathogen. They are developed to induce a robust immune response against bacterial capsular polysaccharides. Examples of conjugate vaccine would be the Hib or the Haemophilus influenzae conjugate vaccine and the pneumococcal conjugate vaccine PCV or Prevnar. With the COVID-19 pandemic, the spotlight was placed on mRNA vaccines. They work by introducing a piece of mRNA that corresponds to a viral protein, usually a small piece of a protein found in the virus's outer membrane. COVID-19 vaccines from Pfizer, BioNTech, and Moderna are examples of mRNA vaccines. So that's it. Let us summarize. Vaccines are substances that induce immunity. Attenuated vaccines are live but weakened. Inactivated vaccines are composed of killed microorganisms, while toxoid, subunit, conjugate, and mRNA vaccines contain only portions of the microorganism. Pause this video, gather your thoughts, and when you are ready, let us have a practice test. True or false? Longer interval between doses reduces the effectiveness of the vaccine. A true, B false. You have 5 seconds. It does not. So the answer here is B false. A history of anaphylaxis or during previous immunization is an absolute contraindication, temporary contraindication. You have 5 seconds. If you answered A, absolute contraindication, you are correct. The BCG vaccine is A, mRNA, B, conjugate, C, inactivated, D, attenuated. You have 5 seconds. D, attenuated vaccine is the correct answer. Vaccine for diphtheria is A, toxoid, B, conjugate, C, inactivated, or D, attenuated. You have 5 seconds. And the correct answer is A, toxoid. If you got 4 questions correctly, you did a good job. If not, rewind this video to check your answers. This ends the slide set. Please do not forget to subscribe to my YouTube channel, Memory Aid Nursing. Thank you.